Hi, my name is Dr. Mytien Goldberg. I'm a board-certified plastic surgeon and a microsurgeon specialized in autologous breast reconstruction here in Beverly Hills. I have a showcase today of a lumbar artery perforated flap and our philosophy of stage breast reconstruction. This is a 38 years old woman who presented to me with right breast cancer. Unfortunately, her breast cancer was large and advanced with positive lymph node in the axilla. So she had to have chemotherapy up front to try to decrease the tumor size. And when she presented to me, she just finished with chemotherapy. So this is her breast. She has some breast asymmetry, but knowing that the cancer was pretty advanced, she will then require, after mastectomy, radiation to the right breast. Why is that an important factor in deciding which type of breast reconstruction is most suitable? Implant-based reconstruction is not the best reconstruction in situation where patient needs radiation, because the patient will have capsular contraction and also an increased risk of infection and implant-based reconstruction failure. So in her knowing that she'll need radiation after the mastectomy, we did a stage breast reconstruction. So after the mastectomy, the first stage, the patient has a tissue expander placement. What it does is that the tissue expander simulate the native breast tissue, so preserve the footprint of the native breast. At the same time, preserve the skin envelope and allow for quick recovery so the patient can go on and have her radiation treatment, which is a very important adjunct tool in treatment of her breast cancer. So after she finished with her radiation treatment, looking at her body habitus, her abdomen is relatively tight because she never had any children. She's relatively thin. So the only areas where she carried the most fat tissue is in her flank, as you can see here. And in this picture, I didn't really show. The best view would be to look at her back. The second stage of the reconstruction is the removal of the tissue expander and the lumbar artery perforated flap. So right after that surgery, you could see already an improvement in her lower torso contour. Her waistline is significantly improved because we use some of that. We use most of that tissue in the lower back and cinch her in. So that you could see the lumbar artery perforated flap here. This is the skin paddle. We place it right underneath the IMF. And in the final reconstruction, she had that skin paddle removal. And this is the fun stage. This is when we did the aesthetic contouring of the entire torso around her chest wall to further accentuate the contour of her breasts and also give her the body that she really desire after the journey with her breast cancer. See, this is where the lumbar artery perforated flap is such a powerful flap in patients that the abdomen or the buttocks or the thigh is not an option. And it is my go-to flap now for women who previously had a tummy tuck, who has a tight abdomen where the usual deep flap is no longer an option. And I prefer it over any flap taken from the thigh or the buttocks, because in this lumbar artery perforated flap, you can see her buttocks, she has a lift in the butt and further improve the contour of the butt. and improve the contour of the lower back. It's almost a Brazilian butt lift result in this case. And the scar is relatively well hidden below a bikini line. So we'll show you the next slide. See, again, the waist is cinched in. It's a natural effect after the lumbar artery perforated flap. And this is the video. She is now 6 months after the surgery. And you can see here, if you wear a bikini, that scar can be well hidden